Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Good afternoon, myself Dr. Babulal Daulagajao. I've done my MBBS from Guwahati Medical College and MD from Kolkata Medical College, and currently I am working as a consultant physician and diabetologist in Akanksha Hospital.
So, doctor, by now we all know what hypertension is, but can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension often it doesn't cause any symptoms until significant damage has occurred. So if you are fine, it doesn't mean that it is not causing you any problems to your heart, kidney, and brain. See, persistent hypertension it increased the chances of atherosclerosis, increase the elasticity of the arterioles. It leads to the increase in chances for heart attack, stroke, and kidney disease. Like as per the WHO announced, in the hypertension, like out of 4% out of every 5 persons, even though they are hypertensive, they are not adequately treated.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
So hypertension we often say is a silent killer because people can live with dangerously high blood pressures without knowing it even for years. Like think of it like as like a pipe or like a rust inside the pipe. It is not visible from outside, but it is causing symptoms or it weakens the whole systems. In the same way, like if persistent blood pressure is there, if left untreated, it increases the risk of stroke, heart attack, kidney disease, and even dementia. Like as per the WHO guidelines 2023, of approximately 10.8 millions of mortality per annum is due to hypertension, which is preventable. And in India, it is accountable for around 57% of stroke death is related with hypertension, and almost 24% of the cases of coronary artery disease or heart attack is related with hypertension.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure?
It is a combination of both, which we can say so most of the cases, like in almost 90 to 90% is due to the lifestyle changes, like due to poor lifestyle change, lack of exercise, poor diet habit, increase in stress, and due to aging is also causes hypertension. But in some extent, if your parents are having hypertensive history of family, in those cases it almost double the chances of having hypertension in your case, and the remaining around 5 to 10% of hypertension are usually due to the secondary hypertensions, which are caused due to some drugs or some kidney problem like chronic underlying kidney disease causing some hypertension.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings,
see, two numbers is very important. First and foremost is systolic blood pressure, the upper level, and the diastolic pressure. As per the guidelines, the AHA recently guidelines, if systolic is more than 130, you see the hypertension. And the time now, it is important, like ideally when to measure. The most important thing is that ideally if you measure in the morning blood pressure or in the clinics, at least 2 to 3 times of documentation is very important.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
See, first and foremost, a change in the basic lifestyle changes. Here, first and foremost, you should decrease the salt intakes and physical exercise. Like daily physical exercise is very important, at least 30 minutes per day or 5 days a week. And if is overweight, and we advise for weight reduction, at least 5 to 10% of weight reduction, it significantly decrease the blood pressure. And you should stop, if you are smoking, you should stop the smoking, and even alcohol consumption has to be stopped. And DASH diet, which is highly concentrated of these, mainly the fruits, vegetables, and low fats diet. Now see what even increase in fruits, like increase in potassium diet, it decrease the blood pressure by excretion of sodium. Now all these activities, now it can significantly decrease the blood pressure around 5 to 15 millimeter of mercury.
Can we say that hypertension can be treated without medication?
Yes, to some extent. In early cases, like if you change, as I've already said, change in lifestyle and weight reduction, in initial cases it might be helpful, or it can reduce the blood pressure at least 5 to 15 millimeter of mercury even without any medications. But in some cases, like in underlying conditions, or if already organ damage is there, then we should advise to recommend with low dose medications.
Okay doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
So when you are taking the medications for blood pressures, that usually what we give a combination therapy like diuretics. After taking diuretics, some of the patients increased frequency of mixation and low sodium level, and some of like beta blockers, we may experience some sort of like cold extremities, and in cases of ACE inhibitors, like the patient may present with persistent cough. So all these medicines, all these symptoms, once if you occur, then you should immediately report to the treating physicians, and those has to be adjusted or changed, but not to stop the medications.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
So it is not necessary like to have medicines for your lifelong conditions. One thing is that if you persistently maintain your lifestyle and diet, and if you decrease the weight, and see, then in most of the cases, even in the initial cases, it might be helpful without medications. But in long run, like if the BP increase, then low effective dose has to be continued in long.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.